Alcohol and drug misuse, dependence, addiction, whatever one wants to call it, are common problems in society today, particularly our society, and they're increasingly common in the young population, as well as the senior population. It's a problem that poses a challenge for the treatment field in a number of different respects. Those can be difficult diagnoses to treat because one of the hallmarks of addiction is denial. And the patient is the last one to see the truth and understand that there is a problem where his drinking, drug use, whatever it might be, is out of control, which means when that's out of control, one's life is out of control as well. Addiction affects every aspect of one's life as well as the people around it. When you have a family who's living with addiction, they're responding to that in abnormal ways also. They get angry, they throw out bottles of liquor, they think the person should have the willpower to change, and they do things which drive the addict to use more or drink more rather than get help. The families are severely affected. Adolescents pose a different challenge because they're young. They think they know it all, they can do it all, and they're vulnerable. Well, the fact is, they can get into serious difficulty with addiction. And they can be a challenge to treat and often require a longer period of time in treatment than adults do. The exciting news is that when adolescents, adults, or seniors get good treatment, they can live a perfectly normal, productive, successful life. And you see people in recovery who've been in recovery for 20 or 30 years who are working as attorneys, doctors, CEOs, successful waitresses, secretaries, and they have good lives, and they're not affected by the addiction as they once were. The only requirement for that is that they abstain from habit-forming drugs. Treatment for those individuals is varied, but most people require some type of treatment, even if one is to go into AA spontaneously. For example, somebody realizes as a result of a DWI that they have a problem with alcohol and they go into AA, that is still a treatment. And if they can become involved in AA, follow that program, practice that program, they can do just fine without anything else. There are other people, though, that aren't able to do it that way. For whatever reason, either they're too sick, they have a co-occurring disorder, they need detox, they've still got some denial, whatever it might be, will require a different kind of treatment. And for that reason, we have treatment programs all around the country. And they range from individual sessions once a week to residential treatment where a person is inpatient. If it's a good treatment program, one can do very well and leave the treatment center and stay well and abstain from all habit-forming drugs from that time on. The most common complication of addiction, however, is relapse. So it's not uncommon to see a youngster, let's say 17 years old, who has gotten treatment and has a relapse smoking marijuana. If they can get back to their program, they can recover from that relapse and remain abstinent from that time on. So it is a relapsing illness. And a relapse does not mean ongoing failure. It means you need to pay attention to it and take some action. But recovery is there for people with addiction. And it's available to people in this country. It's an overlooked diagnosis, and it's one that needs to be recognized more and more as time goes on. And successful treatment programs need to be recognized so that individuals get the treatment that they really need. If you have any questions about that or would like to discuss a particular person or problem, give me a call at 908-305-6404.